of the morning, we have Melanie Sampson. She is the program director of Clear Language Lab at Literacy Works, where she supports mission-driven professionals in making communications inclusive, understandable, and effective. Kind of a lot of what Health Literacy Wisconsin does, yeah. She provides training to more than 500 professionals a year and consults on and revises materials such as flyers, slide decks, handbooks, and web content. She also works closely with community members, prioritizing their perspectives and needs in creation of materials. She is also a board member of Chicago Books to Women in Prison. Please help me welcome Melanie Sampson.
Thank you. Okay, can you hear me, everybody? Okay. Thank you so much for having me today. I'm really grateful to Wisconsin Literacy for holding this event that we can all come together in. And I'm especially grateful to all of you in the healthcare world. I know it's been a really hard last couple of years. So I appreciate getting a chance to hear your stories and be with you all this week. I'm also grateful that I wore a dress with pockets. So that is good. I was out of practice. This is, I think, my third time being outside in 2 years. So I'm glad I remembered that. And I'm also grateful that my pandemic bangs grew back in, so you all did not have to see that today. So thank you. So a little bit about me. I'm going to describe myself. I am a white woman with chin-length, unruly brown hair. I'm in my early 40s, and I'm of average height. Oops, I'm going to go back, sorry. And I come from an adult education background. Is anyone in here from the adult education world? Yes, yay. So that is where I spent a lot of my time working in community-based settings. I worked in supportive housing, I worked in community colleges, and I worked for many years in a neighborhood in Chicago in a adult education program with folks that came from over 30 different countries, as well as people born and raised in Chicago. So that's where my background comes from. And I spent a lot of time with folks. If you are in an adult education program, sometimes you've got students come in 20 plus hours a week. So you really get to know each other and build community. So even though my job was around the learning in the classroom, a lot of times the learning in the classroom couldn't take place unless people had what they needed. And a lot of times those things intersected with health. So a lot of those barriers, were things I was supporting, like helping people navigate their HMO letter. And sometimes I would walk them over to someone else because I couldn't figure it out with my master's degree in linguistics. Helping people access energy assistance so their home can stay warm and they can cook food. Connecting people. We noticed that we had a lot of students that were refugees, but they weren't using our food pantry because they didn't understand, even though it was 200 feet away, that they could use that. Connecting our refugee students with a developing community garden. Many of them had been farmers in their country. So helping connect them with an opportunity to grow food that's right down the street from their house. So even though on paper my job was supporting this program as a whole, a lot of my time was spent supporting students through these systems. And I had some questions. Why are these systems so complicated and hard? As someone who works in these systems, who's always worked in nonprofits, I still struggled to help support my students through these systems. And I asked a lot, who is being centered? Because it wasn't my students. It wasn't me because I was trying to help them and I couldn't. So who are these mysterious figures that things are being centered toward? Because it certainly wasn't us. And why is communication considered such an extra skill? Do we have any communication or marketing people here? Yes. You all can't do all of it. You all shouldn't do all of it. We all write things all the time, right? Whether it's an email, whether it's a note, whether it's a memo, whether it's a slide deck, we're all making stuff all the time. And that can't all just fall on communications people. That's all of our responsibility to embrace. So these were some things that came up all the time, every day in my work, and it really grounds the work I do now at the Clear Language Lab at Literacy Works. So Today I'm going to just talk about some things that I've experienced in my work, specifically around plain language and how I see it as an intersection with accessibility and dismantling oppressive practices. I also want to explore just some of the norms that we don't even think about sometimes because they're so built into systems and things that we can reflect on and how we might be able to do some things differently, and hear from all of you about how you're dealing with some of these challenges. So a few caveats. I don't know everything. I don't pretend to know everything. I'm always learning. I think that's a really important mindset to have. So definitely please feel free, like I said, to share your expertise, or if I'm missing the mark on something, I want to hear about that too. I'm not an official diversity, inclusion, and equity expert, but I am a technical writer who does this work every day, and I don't see how it can be separated. I can't do my work without thinking about this lens. I can rewrite something to make it easier to read, but if I'm not thinking about it through this lens, it's in my mind, I'm missing the mark. So I think this is an important thing that, again, we should all be infusing in our conversations, in our work. I'm going to use the term we a lot. I'm not being literal. I don't know most of you. I've never met you before. But I am referring to sort of these status quo roles in our systems that we know don't work for everybody. So just to be clear. At the same time, it's important, too, to think about the systems aren't like aliens that have come down from Earth and we're just like, being part of them. Like, they're made of people. So we are also people in these systems. So I know it can feel sometimes like we don't have a lot of power. So I want us to keep reflecting on that of like, where do we have agency to make change? And some of this stuff might feel new. I might throw some new words out that you haven't heard before. It might feel a little uncomfortable. I sometimes look at things I've written in the past and go, ooh, why did I do that way? I think that's normal, and I want to normalize us reflecting and thinking like, hey, we're always going to be working toward improvement and working toward making things more accessible. I don't know that there's ever quite an end to that. And I also want to recognize that we all come to the table, we have different identities that we identify with, and that I know that sometimes some of the things that I might be able to say or do might be partly because of privileges that I have in the way I navigate the world. So I want to acknowledge that because I have had conversations with people before who are really passionate about this but say, hey, my workspace doesn't feel safe for me to talk about some of these things. So I don't want to ever presume that if you don't bring up this conversation, you're not trying. I want to acknowledge the fact that we're all in very complicated systems, and just to keep that in mind and acknowledge that. So, health literacy. We all know, we've been here talking about health literacy for the last couple days. And I want to bring this up because I know other people have brought this up too. A definition of health literacy that I think we think is pretty common is that personal health literacy of helping people find information, use it, do the things they want to do, and that for a long time that was sort of the status quo. Sorry, that keeps going in and out. Of focusing on the humans, right? But this past decade, the Healthy People campaign added organizational health literacy. I was super excited to see this because when I think again about a lot of those problems my students faced, they weren't problems necessarily from them not complying or them not reading the instructions right. The stuff was hard, the stuff was complex, the stuff was confusing. And so I think it was really, really important that this gets raised up. There's a really great article that ProPublica Illinois did at the beginning of the pandemic, and it's called The First 100. And they talk a lot about how in Chicago, where I'm from, 70 of the first 100 COVID deaths were Black people. That's not a personal health literacy issue, right? That is a systemic failure. That is not about some people didn't read the handout well enough, right? So I think it's really important to keep that in mind when we're talking about these big systemic things, that these are folks that had full, rich lives, And they were impacted by this horrible, horrible event. But this horrible, horrible event was also led up to by inequities that have existed for a really, really long time. So, I think at the end of the day, the question to keep coming back to is, who are we centering? Or maybe who are we not centering? So I'm going to talk a little bit about plain language, and then I'm going to get into a couple areas that come up in my work. This is certainly not exhaustive. In just an hour, I'm trying to cover as much as I can. But please feel free to ask questions. I'm going to put some examples up as we go too. So if you have thoughts about those, please feel free to share what you think about these things, or if you have great ideas and solutions that you can share with your colleagues here. So, like I said, a lot of my work is around plain language. And this is one definition of plain language. I'm sure a lot of you are familiar with plain language as an idea, but this is a definition I like. It's from the International Plain Language Federation, and it's the idea that a communication is in plain language if its wording, structure, and design are so clear that the intended readers can easily find what they need, understand what they find, and use that information. Now that sounds pretty good, right? I would think that we'd want most stuff to be like that, right? And I think a lot of times when people, when I'm talking about stuff like this, people are thinking plain language. We're talking about jargon. We're talking about grammar. We're talking about organizing ideas. And yes, I'm often talking about those things, but I'm always doing it with the lens of trying to center the community members that I'm really trying to connect with at the end of the day. So even if I'm talking about the passive voice, I'm doing it for a bigger reason, right? I'm trying to make sure that people are getting what they need so they can live happy, successful lives. So I think it's really important to hone in on this idea of the intended reader. So like I was saying earlier, when I think of trying to call the Department of Human Services, or trying to call a legal aid clinic, or trying to fill out a form for my students and being scared I was going to fill it out wrong and impact their benefits. Who are these intended readers? Because those intended readers, they weren't me, and they weren't my community members I worked with. So I think it's really important that we don't imagine that these folks are the exception to the rule. They're the rule. I think there's sort of this idea that there's these people that get everything and everything's fine, and everybody else we're like, oh, we gotta try to hit those people. Well, they're everybody. We're everybody. How many of you have ever had an experience where you've gone to the doctor and felt frustrated or didn't understand or were confused? If you haven't, that's awesome. I have many times in my life. I'm witnessing my parents go through older age and many medical things, and I can't even I have a running list now of the interactions they've had that have been confusing and even harmful sometimes. So I think the intended reader, I really want to think about the idea that this is something we always want to be really thinking about and thinking about deeply in terms of, we talked about trauma. I've heard a lot of conversations about trauma-informed practice. Trauma is really common. When I'm working on stuff, I try to do all of it through a trauma-informed lens because I don't know who's experienced trauma. Trauma isn't something that we can know by looking at someone. Trauma is very personal. So I try to make sure when I'm working on things, I think about things like, hey, am I setting people up so they know what to expect? Am I working on creating a relationship so people can build trust? These are types of things that I think most people would benefit from. So, trying to just think widely of we think about the needs of humans in general, but also making sure that we're prioritizing people that have historically been left out. So this is a group that I think is really awesome. They're called the Design Justice Network, and they're like a collective of people that just care about design. And design, I think in my mind, I'm not a graphic designer, I'm not an artist, but I realized very quickly doing this work that I have to change how I think about myself, because we all make stuff. You write emails, you make flyers, you do slide decks, you send memos. Maybe you don't have any, facing with the community, but you talk to humans, I imagine, in your job. So you are designing stuff. So design is used very loosely here. It doesn't necessarily mean like a fancy graphic designer in an advertising firm. It means anybody you're creating a program, you're designing something. So I just like this idea, and I come back to it a lot when I'm looking for grounding. And it's just this, this is from their framework. They have sort of these 10 principles that they align with as a design justice value system. And this is from that. And the idea is design justice rethinks design processes, centers people who are normally marginalized by design, and uses collaborative, creative practices to address the deepest challenges our communities face. So I find this really helpful to come back to when I'm struggling or when I feel like, hey, am I missing the mark on this? Who am I centering in the content I'm working on? So I'm going to talk a little bit about a couple terms that kind of come up a lot. Thinking about, we've heard terms around, like this week, around culturally appropriate and things like that. We want to make things that work for people, right? Like we all are in this work. We're not in this work for like, oh, we're going to be super rich people. We're doing this work because we care. And so thinking about our identities and how they play a role in how we may think through things. And I can even give you an example. I mean, as an adult educator, I needed butts and seats. Like, I needed people to come to school. That was an important part of our funding, right, is that people participate. But my students had really complicated lives. And I had an epiphany one day that I was putting my values sometimes on what their experience is. I'd have students who say, well, I've got to go take care of my sister's kids. And in my mind, I'd be like, well, you need to come to school. Well, who am I to tell you that school is what is important for you this week? What was important for you this week is building relationships and supporting your family. So I think there's all of these like little ways that our identities infiltrate how we think about things and how we frame things. We all have got lots of identities. I identify as a Midwesterner. I was born and raised in right outside of Detroit. I've lived in Chicago for 20 years. I am a person who has a chronic illness. I identify as neurodivergent. If you don't know what that means, I'm going to talk about it in a minute. We have all these different parts that make us who we are. But we also know that a lot of the bias that people experience isn't necessarily intentional. It isn't, people trying to be mean or harm people. We know that there are a lot of disparities for Black women around childbirth and heart disease. We know that the Center for American Progress talked to trans people in 2018, and 23% of them said they were intentionally misgendered or called by the wrong name. It's 1 in 5 people in that group. That's a lot of people. How are you going to feel about going back to a place that can't give you the dignity of calling you your name? We know that weight bias is very documented in the health field. So it's, I think, always just really important that we're spending time really thinking about how our own identities might be impacting what we're delivering. So this is mostly from a website called Culturally Connected. They're from Canada. There's always so many great resources in Canada. I always am finding cool stuff. But I wanted to just put some of these terms together because we hear them a lot and kind of give you a frame for how I think of them. So we've heard about, cultural awareness was sort of like the phrase a long time ago that you would hear about, like, knowing there are other cultures than your own. And I think cultural competence has been more of a modern way to talk about that, of recognizing that, like, hey, I need to be flexible and I need to adapt and I need to be super conscious of how to make sure I'm working with folks that might have different experiences with me in ways that are appropriate. Cultural humility is sort of like the next level on the chain, and it's really just this idea that we're we're self-reflecting and we're recognizing like we're never going to be done. We're never just going to be like, oh, I did it. I've learned everything. It's always going to be a place of growth. And things change. You're going to see some of the examples we talk about. Something that might be the norm right now might be different in 10 years. And I know that's weird and feels strange to have to like kind of keep up with things. But that's the reality of, you know, things change quickly in our world. So these ideas all sort of work together to create another kind of area called cultural safety. And cultural safety is really just the idea that we're creating spaces where people feel welcome, people feel safe, people feel seen, and really just this idea of connecting to an anti-oppressive framework. So thinking about how are we making sure that our spaces, our practices, and systems are working for everyone and that they're equitable. So definitely, I'm going to have some links to all of these websites that I reference near the end, and the slide deck is in your is in the guidebook. So definitely feel free to explore these further. So this is an everyday form that I actually got from the doctor's office. I'm that weird person taking pictures of my forms in the doctor's office. Anything pop out at you where there might be some like things that could be uncomfortable for someone, confusing for someone? If you're able to see it, I know it's not a very good copy, which is a whole nother thing that we can talk about. Can we get, yeah, I see a couple hands up. Can we?
I'm coming.
Thank you. Yeah, what are some things that pop out at you about where there could be some stickiness for people?
The gender limitation.
Yes.
Huge.
Yeah. Yes. Yeah, right off the bat, right.
I would say that the race boxes are always horrible for me to fill out. I raised my nephew, and he's Native American, he's black, and he's white. And he's always like, what box do I check? And I'm like, check them all. I don't know. You know, it's like, I don't understand why it always has to be limited for statistics. But
Yes. Anybody else? One more? Oh, we've got getting our steps.
Here, and then over there. Thank you. Oh, I was just going to say, actually, with the race one, so I'm Hispanic, and a lot of times it says Hispanic, Latino, and then it has like the white, black, Native American, or other, and I never know what to say on that. I'm like, other, I think? Like, I don't really know, because it's like a completely separate thing. And then I was going to say also the social security number. I've worked with a lot of undocumented individuals, and they don't have a social security number, and they get very intimidated when they see that, and sometimes they think they can't receive care because they don't have a social security number, and they straight up don't have one. And yeah, so that's really hard.
Yes. Oh my gosh, these are great. Maybe one more, if we can get one more.
It may be because where I'm sitting, but the font is very small.
Yes. No, it was. It was very small, and it was like blurry, like it had been copied like 800 times. And, you know, it was hard. I had to like work hard. Like I have like 40-something-year-old eyeballs now, and like it wasn't easy to fill out even just as a piece of paper. Yeah. With someone with different levels of vision, totally. Yeah, we set that up there. Like, and that happens. Like I worked at a community center. Like I know it's hard sometimes to be like, oh, we copied the last one, or we're on the last copy, and this one looks like was made in 1995 on some weird program that doesn't exist anymore, but this is the only one we have, so let's copy it again. So maybe it's thinking through systems like that of saying, you know what, we need to put these all in a system where we can update them easily and cleanly print them. The Social Security question, that's such a great question. Like, why do you need this? Like, why? Like, my mom was filling something out recently online, and she's like, why do they need it? And I'm like, honestly, I never put it. Or maybe I'll put some of it, but I never put the whole thing because nobody's ever asked me for the rest of it, in 40-some years. So I think it's important to know why we're asking for these things, and check regularly and say, hey, how is this going to affect people filling this out? We've also got, I'm nervous about internet safety. Like, I don't really want to put my social security number into a website that I'm not super confident of is going to protect it. We talked about the gender binary there. Like, you know, if I walk in and I don't feel like I fit there, I'm already like barely in the door and I already feel not seen in this setting. Even just thinking about in Chicago, a lot of people live in apartments. So leaving a space for an apartment number, like where I live. I think the race and ethnicity question, you all brought up so many good points about the complexity of it. And I think it's always important to think about, why are we asking? There's a really great TED Talk by a woman named Dorothy Roberts, who's a scholar, and she talks about the complexity of like, why, like, if you're asking for like demographic purposes, she talks about how she identifies as a black woman, but she also is a white parent. Are you talking about this because you're trying to understand some, genetic things? Why are we asking it? And I think we always have to make sure we're being clear, because otherwise, what good is it? It's just probably sitting in a file somewhere and nobody's ever coming back to it to say, oh yeah, we tracked all that information. Like, what are we doing with it? And even asking about my job, like, why do you need to know where I work? Like, my insurance isn't even through my job, it's through my spouse's. So just all of these little elements, and this is just half the form of the first page, and I didn't even hit all of them, I'm sure. There are others. Even just like the preferred contact method. Are you actually gonna do that? Do you have a system in place to like text me instead of call me? You asked for that, but are we set up to do it? So all of these little elements on just one little half of a form, right? It's hard. This stuff is hard. So I want to talk about a couple things that come up again and again in this work. Doing okay on time, okay, good. That I think is sometimes very obvious and sometimes very subtle. So we're going to talk a little bit about ways that white supremacy culture shows up. We're going to talk about some issues that folks in the LGBTQ+ community face, and also just some of these ideas around neurodiversity and how plain language, I think, is really important to make sure we're meeting the needs of our neurodiverse world. So this was an article that came out like 20 years ago. Since then, it went around a lot during the beginning of the pandemic. There was a lot of increased discussion nationally around race and white supremacy culture, especially after the murder of George Floyd. So she actually revamped this website, so it's a little bit more current now. But she talks about some qualities that, the idea isn't that this is a checklist, but I think it's definitely a very interesting exploration of what norms exist in our systems that we especially if you are a person in a dominant culture group, take for granted. So these are just a couple of them that I wanted to highlight. There's, I think, about maybe around 10 or a dozen. And again, it's not a checklist, it's more just an opportunity for us to reflect and say, hey, how are some of these things showing up in our work? Are there opportunities where we can consider how this is impacting our community members? And how can we make it more equitable? So paternalism is one of the qualities that she talks a lot about. And thinking about what tone does content have? How do we talk to people? I'm going to give you some examples, but there are people I work with where I see they have this great relationship, and then I look at the writing and I'm like, this is scary, or this is cold, or this is almost mean. There's a disconnect a lot of times between writing and speaking that's very jarring sometimes. What choices are people offered? Is information delivered with sort of a we know best attitude? Are we taking care to explain new concepts to people so they can really be actively engaged in processes? There's a concept I talk about a lot called the curse of knowledge. It's a cognitive bias. There's two brothers named Chip and Dan Heath who wrote a book about called what is it called? I think it's called Stuck. And but they talk about this concept, and it means basically the idea that once we do our work for a really long time, it's really hard for us to remember what it was like to not know what we know. So even though we're explaining something for the 1 millionth time, that person in front of us might be hearing it for the first time, and that's a really hard thing for us to measure as humans. So I think that a lot of times it doesn't even always happen, with intention, it's that we've done it so many times that it can be really hard to remember that this is not this is the first time this person is hearing this. And I'll give you one more example. So I was working with a daycare, and there was a passage in the daycare that was talking about sleep and that children needed to get enough sleep. And the way the passage was presented was, I would say, pretty patronizing and paternalistic. It was very much like, your kids need to go to bed at this time, and it's very important. And so I we explored that, and I said, well, why do you think if they're not getting enough sleep, why? Do you think it's just because you didn't yell at them enough in the handbook? Right? Like, that's probably not, like, oh, wait a minute. They told me in the handbook my kids need to get enough sleep, so I better make sure my kids get enough sleep. Well, that's not really realistic, right? Like, there's probably a ton of things going on of maybe why their kids might not be getting enough sleep. Maybe parents work late, and they get home and they want to spend time with their kids. Maybe there's a lot of tension in the house. We don't know, but sort of that delivery of this like top-down, like, hey, do this thing. So we talked about like, hey, well, why is it written this way? And a comment came up about trying to show authority. And I pushed and I kind of said, do you mean expertise? Because I get that, like, you want to show you know a lot, you bring a lot to the table. But it was a really interesting tension. Are we trying to be in community with people? Or are we trying to kind of keep these power differentials in place that already exist that, I want to dismantle, but, we might not even realize that we are doing. So that's just one of many examples of these types of experiences that I've come across. Here's an example from a handbook for teens that are new parents that are going back to school. It says, students who wish to breastfeed their babies will work with administrators, childcare staff, and the school nurse to establish a schedule for breastfeeding. The schedule should not interfere with the delivery of core or academic instruction. So where do you see paternalism showing up in this? I kind of emphasized a little bit, maybe too much, sorry about that. What do you see here? Like, how do you think this would feel if you are a young person? Maybe you are a young person of color who is working with a lot of white staff. How would this feel? Yeah, we just heard, if you're the baby, you're going to be like, yeah, I'm hungry right now. I don't care if mom is in history class. Yeah, totally. Yeah, who's being centered in this experience? The staff, yeah. Like, that's going to be annoying for us. So we're basically kind of saying, like, you can do it, but we're really trying to convince you not to. Yeah. Oh my gosh, that's such a great point. So in case it didn't go forth, but yeah, they mention all these different staff. So who am I supposed to go talk to? I'm also maybe like 15 and still like kind of figuring stuff out and dealing with all this stuff. So many things here. And again, this is 2 sentences, and this is loaded with all sorts of judgment and lack of care of thinking about these complex issues. So here's an alternative to play around with. We've got a Q&A. Are you breastfeeding? We want you and your baby to thrive at school. The school nurse, Ms. Lopez, will meet with you at orientation to help you plan your day. We will do our best to help you meet your needs and your baby's needs. What's the difference between the two? Everything. Yeah, I think the things you just brought up, like there's one person now, and we even maybe have a picture of that person so you can recognize them and say, oh, okay, that's my person that I need to talk to. We're focusing on your well-being. We're not just telling you don't get in the way. And Yeah, we're making this a space that's centering you and your baby. I mean, that's the whole point, right? Like, otherwise, why do we have this school if it's not to center the parent and their new baby? So this is the type of stuff I'm talking about that a lot of times, too, this is stuff that, like, when we are making something, it gets passed down from year to year to year to year, right? Like, maybe your handbook thing was written in 1995. Things have changed. Not as much as I would like, but they've changed a lot since 1995. And so what happens is we get these minor little edits, like we fix the date or we fix the change, but the overall voice and the overall tone still has this very patronizing voice to it. Another area is thinking about individualism. And I'm not saying, it's not important for individuals to have agency, like that is not what I'm saying. We want people to be able to make choices, have the knowledge they need to do what they need to do. But I think that, like my example earlier, I think that can come oftentimes at the expense of building community, building relationships, and recognizing the complexities of people and families. Like, I think that came up a lot this week of, like, a lot of times people are working within their family unit on some of these health things. I know that's the case in my family. My mom has this massive chart on the inside of the pantry door with all of my dad's meds. She's got a day calendar, and she's got, like, all the pill things, together. It's definitely a team effort. So thinking about, like, people don't, exist in isolation. They exist in communities and families. And how are we trying to create community with the folks that we're connecting with? Here's an example from a poster. Where do we see sort of this idea of individualism and framing pop up, where we're kind of putting it on the human? Like, why didn't you do the thing? What does it sound like? Yeah, a lot of this sounds like it's your fault. And even like the listing of race and ethnicity. Well, the reason isn't because a person is in that race and ethnicity, right? It's because we have a lot of systemic inequities that impact people in these groups. So I know it's complicated. That's not a pithy thing to put on a flyer, but rethinking about, like, how are we making it seem like, oh, you didn't do the thing, so how is that going to make people feel excited to go be like, oh yeah, I'm going to go to that health fair. They're going to tell me all the things that I'm doing wrong. I'm 45 now, so great. These are we're not focusing on the things that people can do. We're focusing a lot on these perceived deficits that oftentimes are created by much bigger systemic issues. So I think it's important, and we'll talk a little bit more about how we frame things, and even with our word choices, what that looks like. This is a quote from a recent article from an author of a new book on diabetes, A History of Race and Disease. I haven't read it yet, but it's on my list of books to read. But the author says, the biggest thing is to realize that we have for so long preferred to blame disease, and specifically health disparities, on either the biology or the behavior of those who are sick, and specifically populations that have higher rates of disease. That is blinding us to the greater role that is determined by social determinants of health, and specifically by structural racism. So thinking about, even if we're making a flyer, like, what is the frame we're putting on it so that people feel like this is some place that they feel seen and that they feel like this is for them. The last category that I'm going to talk about this is just this idea of the worship of the written word. Well, I know we've all been there where we've gotten a thing that we have to fill out, and we just look for the end of it where we sign it, and we call it a day. We don't know if we just gave them our house. We don't know if we just promised them our car. We just sign it because we need to do that thing, right? Who decided that was good writing? Like, I think it's important, and I put good in quotations. I think it's really tricky when, especially if we spend a lot of time in school, and we spend a lot of time writing in maybe a very specific way to a very specific audience, maybe a professor, and then we get in the world, and we're still writing that way. And that, we equate that with being the good writing. But good writing is about, again, meeting the needs of our audience. And then just thinking outside the box too, like what are ways that, I've heard lots of creative ways yesterday. I was at that wonderful presentation about social media, lots of different ways that we're connecting with people outside of just long, droning text. This is an example from my life. I'm in Chicago, and during Omicron, we had a slew of labs that came up that were very, I don't know if the word sketchy, where they were saying, hey, come get your tests, get your PCRs, but they weren't actually getting people back their results fast or at all. So this was the recommendation from a government official, was to say, hey, just go on the CDC's website and check the CLIA number. So I did that out of curiosity, and this is what I came across. I'm not even sure who the audience is for this. Maybe if you are a science professional, this makes sense to you. I could understand it, but I was blown away that this was the place that I was sent to research on my own. And the only reason I could do it was I happened to have already gotten a test, and I had the digital skills to look it up in my email, find the CLIA number at the bottom, and look it up. Is everyone going to do that? No. That is like, this is not a solution, right? Putting something like this as, we can check off that we did it and we told people, hey, look it up. But this isn't really a real answer to that. Yeah, so just thinking outside the box again, there's so many cool different things people are trying. I don't look at a lot of government websites for guidance, but consumer.gov I think is a really cool one in terms of thinking about accessibility. They've got audio options, they've got language options, they've got size options. Just a really, I think, nice example to check out. Thinking about zines, thinking about YouTube. A lot of this stuff is a lot easier to make now. PowerPoint, you can actually record over each slide individually and save it as a video. It doesn't take a lot of fancy tech to do some of these things. So I want to encourage people to think and be creative too. You can make comics in Canva now. These are things that are a lot more accessible than they were even 2 years ago before the pandemic. If you haven't ever seen this before, this is a really cool law firm in South Africa. It's called Creative Contracts, and they do contracts for people that work on farms that are done in comic book style. So this stuff can be done. I'm not suggesting that everyone has to go hire a graphic designer, but I just want to inspire you to think about some of the ways that we might be able to think outside of the box of how we've always done things. Okay, where am I at? Okay. So I want to talk a little bit about another group. I'm thinking, and maybe not another group, right? Because we know that a lot of people have various identities, and that can impact them different ways. But looking at some of the experiences that folks face that are in the LGBTQ community, we've got some stats here where we can see, this is a survey from the Center for American Progress, and we can see that preventative screenings and needing medical care, there are a significant amount of people that say, hey, I didn't go do that because I didn't feel comfortable. I felt discrimination last time I went through that process. So I decided, hey, I'm not going to do that right now. I don't have that interest in dealing with that again. We also can see here, more than 1 in 10 LGBTQ Americans face mistreatment by a doctor or healthcare provider from their study. And again, we can see the intersectionality. Here we've got all of the LGBTQ folks they talk to. The green are people, specifically people of color, and then the gold are people who are trans. So we can see that definitely some people are even impacted more than others. Again, we talked about this, someone brought this up. Immediately when we look at this, we sort of see this very stark binary. There's not a lot of options. And also, why do you need it? Like, are you going, this was actually for a stomach doctor. So maybe they needed to know it, but did they? I don't know. Maybe it would have been better to just ask me, like, what do I want to be called if they're talking to me? There are lots of things to think about here. Lots of resources. This is an area where you feel like your organization needs growth. These are some examples from the National LGBT Health Education Center of just thinking through, like, are there different different phrases that we might use that might signal to people, hey, this is a welcoming space. We want you to feel seen, and we want you to feel part of this place. I'm not here to be prescriptive, but I want to make sure that we have resources and we can start thinking about these things if we haven't thought about them before. It's really simple to do in a lot of places. Oops. Wait a minute, was that my computer? Oh, see, that was me. I had it on Microsoft Word. Sorry. It must have saved my recording. It does work, see? All right, I'm going to flip through that actually because I've got still a couple more things I want to talk about. Sorry about that. Technical difficulties. That's what happens when you do it. You save it. I must have come back to that. Okay. So here's where we were. Even pictures, right? Thinking about how comfortable do people feel? This isn't even community facing, right? This might be an internal document. But how do people feel if they say, oh, this is the norm that's expected in our hospital? What are we saying about who can be here or how people have to be in our space? So I think sometimes one thing that I think is kind of magical about plain language is that when we're really doing it, it unveils a lot. I work with a lot of programs that have really dense language, and when I start asking questions and start unpacking it, and we have to say in plain language what it actually means, sometimes it's not pretty. And it really causes some reflection to say, oh, that's what we actually mean. Well, that's not what we want to mean. And it can, I think, reveal some things that then we have to deal with, which I think can be a really good thing. But when we keep it all kind of tied up and vague, sometimes it can be really easy to ignore it or just kind of keep it buried on page 72 of a handbook. Okay, the last point I wanted to talk about is just this idea and introduce, if this is new to you, the idea of neurodiversity. So neurodiversity, the paradigm of it, the idea of it, started a couple decades ago from a sociologist, an autistic sociologist who really wanted to look at like the brain the same way we look at like the environment, right? Like the ocean. Like it's a great thing that the ocean has so much biodiversity. Like that makes a difference. All different things play different roles. And then that's kind of evolved to this idea of neurodivergence, which is sort of a little bit of a like lens of thinking about, hey, how do we expect people's brains to operate? If mine doesn't operate that way, that doesn't mean something's wrong with me. That's where the idea of neurodivergence came from. It's sort of a counter to the idea of neurotypicalism, which just means like how society expects us to act, expects us to interact with the world. I was actually diagnosed very late in life with ADHD, and a whole wealth of things opened up for me from having that diagnosis. So I think what we've seen is the last column is this movement toward neurodiversity as a movement, and really thinking about when we're talking about folks that might have, ADHD, intellectual disabilities, autistic people, that this is part of the wonderfulness of our world, that people's brains are different. It doesn't mean that life is easy for everyone and that things are accessible for everyone and things aren't hard, but really trying to kind of flip the lens again that those folks are different and special. They're everywhere. They're everybody. And trying to make sure that becomes more normalized. So again, I think even something as simple as this is an example actually from a real document I got from the doctor's office. This big block of text. We don't have to write paragraphs that have 10 sentences. They can have like one. They can have two. I give you permission. They don't have to be, these blocks like this. This is actually really hard for someone. I read really fast, if I'm being honest, but that's still hard for me to read because I look at it and my brain starts to crackle. With something like on the right, I can skim it and it's easier for me to see what's relevant for me. Oh, I don't care about the second part. I'm jumping to the third part. So thinking about that, another way we can say that this supports people is helping people who have a lot that's taxing their brain. They have a heavy cognitive load, a heavy cognitive tax. And that's not just people that have some sort of diagnosis. If you're tired, if you're hungry, if you're stressed out, all of these things. I know my mom got a document from the insurance company about a medication issue, and I saw her look at it, and I saw her put it down. I saw her take a heavy breath, and I walked over, and I was like, what's going on? And I took it from her, and I took about 45 minutes to rewrite it, because that's the kind of nerd daughter I am. And then I went back to her, and I go, hey, Dad's medication is only going to be covered for like one more dose. And then he has to, it's either going to get expensive, or he has to talk to the doctor about sending a note or switch medicines. That's what the whole thing was about. But it had these caps, it had no headings, it was a big mush pile. You know, my mom has a lot on her plate. It might have taken her days to come back to that and make sense of it. And meanwhile, maybe they would have gone to pick up the prescription, and it cost, I think it was expensive. It was like thousands of dollars. So they would have been for a rude awakening if we hadn't had the opportunity to have that moment. So we talked about those things. A couple other things I want to talk about in terms of just framing language. And this kind of fits back with all those other things, but we've done a lot of projects with drug courts in the last few years, and I came to those really surprised, I guess, because you know, I'm thinking about substance use as a public health issue, but there's still a lot of language embedded in these conversations that's very stigmatizing and blaming. There's a really interesting short paper that came out from the National Institute on Drug Abuse, and they just talk about some of these words that are very stigmatizing and reiterate that this is just a personal failure. Like, oh, you can't get your problem under control, versus this is a medical issue. And we've seen, you know, a shift over the years, but this is way too long coming. We've you know, this ties to everything. We have a whole system of mass incarceration built around, you know, having these frames around who fits in these different categories and what it means. I just read a really great book. I just finished it. It's called There Are No Accidents. And it talks a little bit about the drug wars. And it just talks a lot about how there are no accidents. Like there's a systemic failure. And we sometimes call it an accident because that's a lot easier than addressing some of these systemic issues. But oftentimes these systemic issues impact the people that are most vulnerable or at risk of harm because of the way our systems are designed. Even thinking about how we talk about, oh gosh, there I go again. All right, I'm gonna jump back to that and explain. So that is from a group called the Marshall Project, and they do all sorts of work around talking about incarceration and the humans involved in that system. And they actually just did a survey and they asked people, what do you want to be called? Like, how do you want to be talked about? So I think we talked about that a lot over the last few days of like, talk to people and see what they think. And they actually, the number one answer was like a person who is an incarcerated person or a person who's incarcerated. But we think about how many times we see things like this that use terms like inmate, ex-offender, things like that. Even some terms that I think are meant to be more humanizing can be confusing. You know, I talked to some folks recently I have a community group that I meet with, and the term returning citizen was there. And I know that that's a common term that gets used. I know when I worked in workforce, that's a common term. But no one knew what it meant. Everyone was like, does that mean a person coming back into the country? Like, what is a returning citizen? So I think sometimes it's tricky, too, when our field kind of creates these euphemisms, but people don't know what they mean. So I think that that's also something important to think about. And then I just wanted to mention the idea that no group of people is a monolith. There are, I put this example up. There's a lot of great websites that are working to expand representation. This is one of them. It's called the Disabled in Here Project. And I bring this up because they specifically asked to use identity first language. So I know that a lot of times person-first language is what we use in a lot of settings, but I think it's important too to remember that there are some folks that prefer identity-first language because they feel like this is part of who they are. So I know that can be tricky sometimes because maybe we've got to use multiple terms if we're talking to a group of people, but I just wanted to kind of bring up, I know it's complex, but that this is a thing. I know in the autism community that's a big thing, thank you, that it's really important for a lot of people to have that as part of their identity. It's part of who they are. So I definitely encourage you to explore more around these things and talk to people who identify in these ways. And I guess I just want to make sure we come to this idea that neutrality, I think, there's not a lot that's neutral. We might think we're Switzerland, but we're always making these choices, right? We're always making decisions in our work. So just to kind of always keep that in mind, like, who am I trying to center in what I'm doing? I'm going to skip that because we are running close on time. I want to just briefly think about actions. Oh gosh, there I go again. I'm going to remember to listen to it next time. Okay, I'm going to go back here. I didn't talk on this, great. These are a lot of the resources I talked about today. Definitely feel free to check those out. There's a plethora of stuff out there, so definitely be curious. Keep learning about these different elements. I would love to know, like, I know we're very close to the end. This is not, I know, the easiest stuff to figure out. There's no checklist for all of this. I could make a checklist, but it wouldn't be enough. But I really just want to emphasize with this quote from Adrienne Maree Brown. She wrote this wonderful book called Emergent Strategy. If you haven't read it, it's great. What we pay attention to grows. So I think that's been a theme a lot of this week, is that health literacy isn't like an extra thing, right? And I know that we're all like in it trying to like help other people see that this is like integral. This is what it's really about. It's not about like, I can run a program, but at the end of the day, it's not about my running a program well. It's about me working toward a more just world. It's about working towards centering people who haven't been centered and thinking about things through that lens. I would love to talk more to folks if anyone has any examples that they want to share or any challenges they want to share. Definitely please feel free to reach out to me and talk to me about those things. That is my contact info. Melanie@litworks.org. I'm on the internet all the time, so please find me in all of those ways. I think we have about 2 minutes left. Does anyone have any questions or thoughts? Or yes, we've got someone here. Sure. Yeah.
Okay.
And if I missed any, feel free to email me and I'll make sure I get you whatever I need.
Hi.
Yes, hi.
I'm just wondering if you could talk a little bit more about, or just kind of give a little bit of your thoughts on this. I don't have the right words to fully articulate it, but the connection between like the idea of grammar Nazis, white supremacy, and getting away from that focus on grammar as a form of anti-racism.
Ooh, that's such a good question. Yeah, I think of myself as in a linguist term, there's sort of the prescriptivists, which I think you're referring to, which are the folks that say, this is the rules, this is how it is, and then the descriptivists were more like, hey, this is really neat, what's going on here? And I definitely, my brain sometimes thinks I'm a prescriptivist, but my heart is a descriptivist. I think that language is so neat. I think it's so cool how we have new ideas that we can change how we express ourselves. My spouse is an 8th grade teacher. He's always telling me about new slang words that I don't know and have to look up on the internet. Yeah, I think it kind of comes back I don't have a full answer for this, but I've thought about it. And I think it kind of continues to come back to that idea of like, what are we trying to accomplish? Is our goal to impress a funder, or is our goal to connect with people in an authentic way? And I think those questions are always kind of good to go back to and think about like what are we doing? It doesn't mean that we want things to be clear, right? So if there's a problem with how something is written and it's not clear, I think that is a fair issue to talk about. But I think more often what I see are things that are like 50-word sentences that are in the passive voice that are unclear, and we are okay with those, but we might not be okay with other types of ways people write. So I think that's a really great question. I don't have all the answers for that, but I'd love to keep talking about that more. But I think it comes down to clarity in who our audience is, and are we being respectful to our audience. I think those are some of the key things that I try to go back to when I'm kind of mulling the same questions. Yeah. Oh, I'm sorry. Time's up. I'm happy. I don't know. I'm happy to chat with you afterwards. I don't know if I'm getting the hook. There are a lot of good resources that exist. So if you want to email me, I'm happy to email with you about some ideas for sure. Please feel free. Thank you all so much. Thank you for all you do, and have a great rest of your day. I'll put my, here we go.